Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's lecture topic of ENT is complications of suppurative otitis media. We divided our lecture into 5 sections. In the first section, we will talk about the overview and classification, in which we will talk about the factors that influence the development of complications of suppurative otitis media. Then we will talk about pathway of spread of infection, classification, and then we will talk about the sequelae of otitis media. In the second section, then we will talk about intratemporal complications. In this, we will talk about pathology and clinical features of intratemporal complications. Also, what's the diagnosis or how we diagnose intratemporal complications and what are the differential diagnoses. And then we will talk about management and treatment. In the third section, we will talk about Petrositis and labyrinthitis. And then we will talk about some causes that leads to Petrositis and labyrinthitis. What are the clinical features of labyrinthitis and Petrositis and how they can be managed and treated. In the fourth section, we will talk about intracranial complications. In this, we will talk about clinical features and treatment of intracranial complications. Then we will talk about subdural abscess, otitic hydrocephalus. And then in the fifth and final section, we will talk about meningitis and lateral sinus thrombophlebitis. Pathology and clinical features, how they are investigated, and what are the complications of meningitis and lateral sinus thrombophlebitis. And also we will talk about the management and treatment of meningitis and lateral sinus thrombophlebitis. So it's a pretty long topic, and hopefully you will keep watching sqadia.com to learn more about complications of suppurative otitis media.